How does immunotherapy treat Ewing sarcoma? Imagine a treatment that trains your body's own defenses to fight cancer more effectively. That's what immunotherapy aims to do for Ewing sarcoma, a rare bone cancer that often affects children and young adults. Instead of just attacking the tumor directly, immunotherapy boosts the immune system's ability to recognize and destroy cancer cells, which can sometimes hide from traditional treatments. One promising approach is called CAR T-cell therapy. In this method, doctors take a patient's T cells, which are immune cells that fight infections and cancer. They modify these T cells in the lab to produce special receptors that recognize specific proteins on Ewing sarcoma cells, like the insulin-like growth factor 1 receptor. Once these engineered T cells are infused back into the patient, they can seek out and kill cancer cells more precisely. Preclinical studies have shown that these CAR T cells can significantly slow tumor growth and improve survival in models of localized sarcoma. Researchers are also working on ways to help these cells infiltrate the tumor more effectively by modifying them to bypass physical barriers within the tumor environment. Another area of research involves monoclonal antibodies and immune checkpoint inhibitors. Monoclonal antibodies are lab-made proteins designed to target specific molecules on cancer cells or to block immune checkpoints, proteins like PD-1 or CTLA-4 that normally keep immune responses in check. When these checkpoints are blocked, T cells can become more active and better able to attack tumors. While immune checkpoint inhibitors have shown success in other cancers, their effectiveness in Ewing sarcoma is still being studied. Often, these drugs are used alongside other treatments like radiation to boost the immune response. Natural killer cells are another part of the immune system being explored for Ewing sarcoma. Unlike T cells, natural killer cells can attack tumor cells without needing to recognize specific antigens. Since Ewing sarcoma cells tend to have low levels of MHC class I molecules, which usually protect cells from natural killer attack, therapies using natural killer cells might bypass some of the tumor's immune evasion tricks. Researchers are also investigating cancer vaccines that stimulate the immune system to target tumor-specific antigens. These vaccines aim to teach the immune system to recognize and attack Ewing sarcoma cells more effectively. Additionally, scientists are exploring ways to modify the tumor microenvironment, such as by increasing the production of chemokines like CXCL10, which attract immune cells into the tumor, or using oncolytic viruses that infect and kill cancer cells while stimulating immune responses. Combining immunotherapy with traditional treatments like chemotherapy or radiation is another promising strategy. These combinations can increase the releases of tumor antigens, making the immune system more likely to recognize and attack the cancer. For example, combining CAR T cells with immune checkpoint inhibitors or agents that alter the tumor environment might help overcome resistance and improve treatment outcomes. Overall, immunotherapy for Ewing sarcoma focuses on enhancing the activity of immune cells like T cells and natural killer cells, targeting specific tumor markers, and improving the immune system's ability to infiltrate and attack the tumor. While many of these approaches are still in experimental stages, early results are encouraging and offer hope for more effective treatments in the future. It's important to remember that each patient's situation is unique, so consulting with oncology specialists is essential to determine the best approach. As research continues, these innovative therapies could become vital options alongside existing treatments, helping to improve survival and quality of life for those affected by this challenging cancer.